Several restrictions are back in place in Texas as the coronavirus surges there. Bars are reclosing as hospitalizations, and that's key. Hospitalization spike. That means people getting sick. In the last 6 days, cases have jumped by more than 5,000 new cases each day in Texas. With me now is Dr. Pritesh Gandhi. He's a primary care internal medicine physician in Austin. We should also note Dr. Gandhi is running for a congressional seat in Texas. Doctor, good to have you on.
Good morning.
So the Texas governor, Greg Abbott, who pushed for reopening in the state, now says that the outbreak has taken, in his words, a swift and very dangerous turn there. What do you attribute that to?
We're very concerned here. Look, June 6th, we had 80 hospitalizations in Austin due to this virus, and today we have 350 people in the hospital in the Austin area. It's quite clear. The reality is that we don't have a mandatory mask mandate in place. We have not been able to pursue effective social distancing, and bars operating at full capacity and restaurants operating at full capacity for indoor dining has led to a situation where we've seen the massive spike that we have. We've had a just exponential rise in cases and hospitalizations since phase 1 and phase 2 reopening here in Texas.
Okay, so what needs to happen now to get this under control? And can stay-at-home order? I mean, listen, masks goes without saying. Folks got to wear masks. I mean, even the vice president is saying that now. But in terms of reopening, do you need to see a statewide stay-at-home order, or can the state be more targeted to cities and counties that are seeing the biggest spike in cases?
I don't think we need to have a statewide order if the state can master basic public health fundamentals. Without a question, bars needed to close down, which they have. I do believe that we need to shut down in-person dining. Right now, we're at 50% capacity as of today, per the order from last week. But we have to go beyond that. We need to be putting up pop-up testing sites in neighborhoods. Right now, we're expecting people to take public transportation to come to the drive-through testing sites if they don't own a car. And that's not a way to be able to test the folks that we need to test. So we need pop-up testing sites. We don't have nearly enough contact tracers. We need to hire the thousands of unemployed Texans to do that work. And so there's work to be done. And even at the basic level, we're talking about PSAs that could be put on television about the importance of wearing a mask and social distancing, especially as early voting gets started today here in Texas.
It's not anecdotal. It is in the data now that more conservative folks who rely on more conservative media have a different view of this virus, how dangerous it is, what they need to do about it. And the fact is the president is one of the sources for that, right? He doesn't wear a mask. He questions why the outbreaks are happening, not backed by data. In Texas, does that make it harder to respond to this effectively?
It absolutely does. You have seen colleagues of mine in public health under attack across this country. Unfortunately, it runs concurrently with the rhetoric of a president who has espoused science denialism from the very beginning of his term. It makes it extraordinarily difficult to be able to convey basic scientific principles when those very same thoughts are under attack by a president who either peddles therapies that don't work or are proven to harm the American people, or decides to go around the country without wearing a mask. I mean, this is the reason why we need diversity in leadership and science-driven leadership at all levels of our government. And so we need examples at the highest level, and we're just not getting it from the president.
We have July 4th weekend coming up. Around the country, folks like to do things. They like to go to public spaces. They like to see friends. They like to go to restaurants. They like to go to beaches, etc. What should people do and not do this weekend?
I think I think without being said, folks need to wear a mask. There's no doubt about it. Wherever you are, outside in large or small gatherings, please wear your mask. Think critically about the need to be out in gatherings in public. This is the time for Texans to double down on staying safe and staying indoors, isolated if possible. We are deeply worried. I cannot convey to you what it means. I'm in my scrubs because I'm about to head to a clinic We have 21 patients scheduled for drive-through testing this morning. 4 weeks ago, we had 3 patients scheduled. ICUs in the Houston area are near capacity. We are quite clearly talking about people's lives, your neighbors' lives, the well-being of the healthcare professionals on the front line. So wear a mask, avoid large gatherings, try to stay with your family indoors if possible, avoid in-dining at restaurants. These are basic things that we can do to get us through these next 2 or 3 weeks.
We'll see how many people listen. Dr. Pritesh Gandhi, thanks very much.
Happy to be here.